Hey guys, welcome back. I'm really excited about this episode because for the first time I'm going to record a question and answer session of all your questions, which I'm going to answer one by one. So here goes. First, it's from Rama Sundar. Rama Sundar says, "Thank you, doctor. I have been having cervical spondylosis since 1988, keeping it under control by doing yoga. It has become chronic now. Happy that you have shown these exercises. Will start them doing right away. Thank you once again." So if you've been having cervical spondylosis since 1988, it means that by now, if you have been able to do exercises and you're keeping it under control, the strength of your muscles in the cervical spine is very good. And the exercises which I have taught you will complement your yoga exercises. But just remember, if you're having continuous pain after any new exercise you do, it's time you stop those exercises and contact your doctor or your physiotherapist. All right, Rama Sundar, thank you so much for asking your question. Next is Sunil Keskar. He says, "Doctor, is lubrijoint a good pill to take?" Now, when it comes to osteoarthritis, or rather health of any of the tissues which help you move, like ligaments, tendons, cartilage, stuff like that, medications like lubrijoint have amino acid molecules which help synthesize cartilage, or they rejuvenate the cells which are in the bone, the tendon, the ligament, and also the muscles. So any of these pills will help your osteoarthritis or will generally help inflammation, especially if they have collagen or glucosamine or chondroitin. The only thing is you have to take them for a period of 6 weeks at least to see some improvement. But as they are amino acids, you have to make sure that you do not have a kidney issue or that your urea and creatinine is all right. And also make sure that you do not overdo these tablets, because if you're not seeing any improvement in a period of 6 months, means that you need to go to the next level of treatment. Sunil also asks, "Doctor, please explain about the beginning of arthritis and how to cure it." Okay, beginning of arthritis can be from wear and tear, arthritis can be genetic, and arthritis also can be autoimmune. So if it's from wear and tear, it's called osteoarthritis. That is, if you overuse and abuse your joints and you do not strengthen your joints, then you have arthritis, which is because of wear and tear, which is commonly called osteoarthritis. And then you have genetic arthritis. So some people could have a genetic predisposition to have arthritis, and that could be something like juvenile rheumatoid arthritis. And it could happen even when they are 13 or so. Such arthritis starts primarily in the small and the big joints, and they have a varied distribution, especially in a juvenile age group. And then comes the immune related arthritis, like autoimmune arthritis, like rheumatoid arthritis or psoriatic arthritis, where your body is producing antibodies against your own joints, and your joints get inflamed because of that. Treatment primarily would be, if you're having osteoarthritis, of course you can take nutraceuticals like lubrijoint or collagen in order to improve your cartilage growth and also reduce inflammation at an early stage. Exercises are extremely important. If it is progressing, then we have injections for platelet-rich plasma or bone marrow injections, and also lubricant injections inside the knee. If all these with exercises and weight loss, it is very important that you have to eat right, you have to exercise, and you have to target on weight loss. These three, with all these non-surgical options, should help you with arthritis if you're in an early or in a moderate stage. If all these do not help, then you have to talk to your orthopedic surgeon about what invasive options are there in order to treat your arthritis. Thank you, Sunil. Next, going to Tarian George. "Dear doctor, very logical and important advice. Thanks." Thank you so much. for listening, Mr. Therian. Your advice is requested for. Here goes. My friend's 19-year-old daughter had mild COVID in Jan 21. That is almost 7 months ago. And 2 months later, she took the Covishield vaccine first dose. She had a severe reaction that night and was rushed to the hospital. All right. For 6 hours, her SpO2 was only 68. She had low BP, chills, fever, pain in the chest and legs. Given bronchodilators, hydrocortisone, X-ray and blood test was okay. Recovered the next day. History of breathlessness, BP 90/57 sometimes. Should she take the overdue second vaccine now? How to take precautions? All right. First of all, I'm quite surprised that it happened. If she has had an allergic reaction to Covishield, because what you're saying seems like it is an allergic reaction to the vaccine. In that case, what ideally has to be done is first let us see in 6 months if she has any leftover immunity from the natural infection, which is COVID, and also from the first dose of the Covishield vaccine, because even though she got a reaction, there is no reason why antibodies should not be produced. And if you do the antibody test, so there are 2 tests, antibodies for SARS-CoV-2 and an antibody for the spike protein. In some parts of India, in many parts abroad, we have antibodies for the neutralizing spike protein also. If we are able to do that, that actually shows how much strength our antibodies have against neutralizing this virus. So if she is able to do all these 3 tests and if her antibodies are good, then we need not take a chance and give the second dose now. But if her antibodies and her protection is not good, let me tell you what has to be done. The second dose need not be the same vaccine if it has created an allergic reaction. It can be the alternative. It can be Sputnik or it can be Covaxin. And you should expect that she has an allergic reaction even the second time. And so you should have the vaccination at the hospital in an emergency with a physician with an IV line set up and emergency drugs ready with a doctor attending. And she has to stay in the hospital for 12 hours after the vaccine and then she can go back home. This would be the ideal and the most safe way for her to take the second dose of the vaccine. I hope I have cleared your doubts. If I haven't, please elaborate and I will clear it out for you. Thank you for asking the question. Then we go to Vinod S. Hi doc, I hope all is well at your end. Yes Vinod, it is. As usual, a detailed session. I like the way you started with a kind of a book index as to what will be covered in it and ended by covering all. The nerd in me can't change it. The player watermark is awesome. I have asked below a while ago, can you cover it in the upcoming physiotherapy session please? Can you please talk about L4, L5 disc degeneration due to bad posture, deviation in the spine's natural curvature, etc. How to regenerate the disc if possible and getting back to everyday life like bending forward, flexible, carrying weights like water, pot, etc. Main eligibility in Chennai because we do not have water and many of us use those 20-liter water cans which have to be upturned, and yeah, it's not easy. I can understand. In simple words, should not live a restricted movement lifestyle. So what I am assuming is that you or somebody you know has L4, L5 disc degeneration. So disc degeneration, L4, L5. So if you take the spine has L1, L2, L3, L4 and L5. So L4, L5 is the disc which is there in between L4 and in between L5. And if you see this disc is nice and thick and you see that it is healthy, you see that it is not impinging on the nerves on either side. sometimes what happens is because of a lack of nutrition or because of an injury to the disc or because of wear and tear excess in that region, what happens is that the size of the disc, the thickness of the disc, the consistency of the disc can reduce, and this can create lesser space in that area, which we call as degeneration. And when the space reduces, what happens is there is a possibility that this nerve root is impinged, and this is what is commonly known as disc degeneration. Yes, how to regenerate the disc if possible? If we have completely removed the disc, then sometimes we give intradiscal injections of platelet-rich plasma or bone marrow concentrate in order to reduce inflammation and regenerate the disc. But exercises specifically to strengthen your back, which has to be done, especially if you have disc degeneration, it has to be personally taught, because we need to assess your flexibility first. And based on your flexibility, graded exercises have to be started. And it's not just enough if you strengthen just your spine, you have to strengthen your core, you have to strengthen your obliques, and you also have to strengthen your glutes. Only when you do that, you can achieve good flexibility and good movement if you have disc degeneration. And also exercises for disc bulge, I will do a separate session just for exercises on that so that it is clear. Thank you for asking the question. Next is Ganesan Annasamy. Excellent, doc, thank you. I am 72. Wow. I play tennis every day mornings. That is fantastic. Every day morning, I wake up with tight muscles on the lower back and pain, and I can't bend. It reduces slowly after nature's call. I have acidity problems also. Added to this, I have low back pain when I sit on the stomach for 10 minutes. I have been doing all stretches as per proper advice. Very good. These stretches definitely take care of the day, but then the mornings are really bad. I walk briskly 10 kilometers a day, morning and evening. All right. So you're 72 and you're so active. It's fantastic. Okay. I wish everybody who's 72 does all the things you do. Now, coming to an side effect of being so active when you're 72 without training the muscles which you need in order to be this active. So you have told me that you play tennis, you have told me that you walk, but you haven't told me whether you do weight training or whether you do specific exercises for your back, whether you do exercises for your stomach, whether you do exercises for your shoulder, for your upper back, for your hips, which are extremely important to play tennis. If you are somebody who's not doing those exercises, then playing tennis could just strengthen your cardio, but could wear out all those joints and all those ligaments and all those soft tissues which you are using just to do the cardio, that is just to play tennis and just to walk. So I would suggest first, you have to do an MRI of your lumbar spine in order to see if you have any disc issues in your lumbar spine. And then if you do not have any disc issues, contact a physiotherapist who is also trained in exercise therapy and start exercises for your core, your lower back, your shoulders, your upper back and your hips, because these joints are under severe stress with your ankle joint when you play tennis. I hope I've answered your questions. If you want anything a little more specific, just ask me and I will answer the question then. And then I have a question from Tess Itodo. Thank you, doctor, for enlightenment. Welcome. I hear about this cream ARTHRITIS. Will it help my lumbar spondylosis? So generally any cream, any ointment works by 2 or 3 principles. It works by either heating the skin, it works by chilling the skin, or it works by irritating the skin. There are some ointments which claim to go inside the skin and provide nutrition, but there is no evidence for that. Anything which helps you reduce your pain, you can use, as long as it's not creating an allergy for you. I advise a lot of ointments, I advise heat, I advise icing, I advise alternating it. I even advise if you can buy the TENS machine. It's a small electrical transmitter which gives stimulation of the muscles, and you can use it in order to reduce your pain, do it. Any method in which you are not taking medication inside, in which you do not know the side effects, is all right. So if Arthritis is helping any of your friends, then please go ahead and use it. Thank you. Then Ramesh Vakde. Hi doctor, hello. I have shoulder pain in the right and left. Okay, you have right and left shoulder pain, and on either side I have done an x-ray and the doctor says nothing to worry. But it's 2 years now and I still have the same pain. That's not good. I used to do regular dips in the morning, about 30, I think he means pull-ups and sit-ups. That is it, and I stopped now. So again, I asked the doctor about the pain and I stopped the exercise and why it is paining. He told to take painkillers. I started following your COVID-19 videos and now I saw your knee pain and shoulder. Could you please suggest me on the same? I can't even play badminton, which I love to. First of all, I'm going to suggest, because I want you to start playing badminton. I want everybody to be active and everybody to be moving. So your problem seems quite simple to me. If you have been doing sit-ups and pull-ups and push-ups, most probably you have created a partial tear in your rotator cuff muscle, especially the supraspinatus muscle. So, and especially if it is persisting for 2 years, then there is definitely a partial tear which has changed into a chronic tear or a tendinitis, which is an inflammation of the tendon. So what I would suggest is, I would definitely ask you to do an MRI scan of your shoulder, and you can tell the scan center to look for a rotator cuff injury. And if you have a rotator cuff injury on the MRI scan, then you will have to take the necessary treatment. That is, it could be medication, it could be exercises to strengthen your rotator cuff. If it is a partial injury, then PRP injections or bone marrow injections inside the cuff will be enough. If it is a complete tear, then you might need an open or a closed repair. Whatever it is, an MRI will tell you what is going on inside your shoulder. So get that, and I will be able to help you out on how to go about it after you do the MRI scan. All right, I hope I answered your question. Then coming to Juliet Nair. Doctor, can you advise me on an immediate remedy for grinding sound which occurs in my upper neck cervical region while moving my head, apparently due to low calcium? Okay. No grinding sound occurs in the neck because of low calcium. I haven't read it in any orthopedic textbook nor in any of the journals. Many times grinding sounds occurs in the neck and there is no problem in your neck. It is just that when your joints move against each other, sound is there, unless you have pain. If you're having pain, then the answer is not to take more calcium. The answer is to do exercises to strengthen your neck. Any physiotherapist will be able to teach you those exercises. Generally, if you have low calcium, it would show up more as fatigue, tiredness, inability to do activities. It will not show up as a grinding sound. And also, if you want to know if you have low calcium, then you can do a test called ionized calcium, which actually shows how much active calcium is there in your blood. So do that for your grinding sound, neck exercises, and I think you will be good. Mandira Dhar asks me, thank you so much, doctor, for this video. Welcome. It's a great pleasure that you liked it. Kindly do a video on scoliosis and how to come out of the problem. Yes, I will, but just for now, scoliosis is when you have a sideward bending of the spine. So instead of the spine being straight, your spine is bent like this. So you know what happens. In a young age, you'll have low back pain. You won't be able to sit for a long time. Many times scoliosis normalizes. At a young age, it's called functional scoliosis. It is there because of some imbalance in growth, some genetic reason. But as we become older, generally our spine straightens. But if it doesn't straighten and it continues, then we could have a problem known as scoliosis. And if the angle is very high, then the possibility of that scoliosis affecting your activities of daily life is also very, very high. If you have functional scoliosis and it is mild, then we can do exercises and you can lose weight and your issues will not be that severe. But if it is a significant scoliosis, then surgical correction is the only answer for you. Thank you. Now, Srinivas Kanchan. Sir, I'm a diabetic patient, so am I, but I'm in control. I hope you're in control too. Nowadays, a sensation in the right hand small finger has subsided a bit. Why is it so? Because of diabetic or frozen shoulder? Please advise. So diabetes generally has a reduction of, uncontrolled diabetes generally has a reduction of sensation in the peripheries. It is because of your nerves not functioning as well as they used to because there is too much sugar in the ends. But very rarely does it happen in a single finger. So most probably, and it also primarily starts in the feet. So most probably it is not because of diabetes. It could be because of frozen shoulder, very rarely, because if you're unable to move the arm, you could have an impingement. But if you're having loss of sensation or reduction of sensation in the fingers, it's probably coming from a nerve issue. So please go get examined by an orthopedic surgeon and do an MRI scan of the C-spine in order to see if there is any structure there which is pressing on it. Yeah. Then coming to Mrs. Lakshmi Balasubramaniam. Thanks for the video, doctor. I manage my knee pain with exercises and knee strengthening. If you teach us exercises, it will be more informative. Yes, I'm going to do an episode of knee strengthening exercises. But for now, if you're somebody who's going to the gym or if you're somebody who can buy ankle weights, then focus on exercises for your quadriceps and for your hamstrings. A very simple way of doing it is to buy 1 kilo or 2 kilos or 5 kilos ankle weights, tie it to your ankle, sit on a high surface like a bed with your leg hanging down, and you can straighten your leg and bend it. This strengthens your quadriceps, which are the muscles in the front of your thigh. And if you do the same thing lying down on your stomach, straightening the knee and bending it, then it strengthens the back of your thigh, which is the hamstrings. And that is the simplest way you can start strengthening exercises for your knee. Mr. Sambandham says you defined tendon, ligaments, but not cartilage. What is it? So cartilage is a rubber-like substance which lines all the surfaces of the bones which make up our joints. For example, if you take the knee joint, this is the thigh bone, this is the leg bone. So at the place where both these bones meet, where we move, the area which is in contact will be covered by a whitish rubbery substance which is known as cartilage. If your cartilage is good, then generally you will not have any pain of arthritis. Mr. Muralidharan says, dear doctor, very helpful session on knee pain. Thank you very much. I understand a lot on this subject. He's also asking for exercises. So as you guys are asking so much for knee exercises, that's going to be my next video, which is coming up. Hiran Pandya asks, walking 30 minutes as an exercise, will it reduce pain? Walking as an exercise is very good to increase blood flow in the lower limbs all over the body, and it's also a good cardio. But will it help your knee pain? No, it will not. In fact, it might aggravate your knee pain. You need to do specific exercises for knee pain, which I'm going to make in the next video for sure, so that your knee strengthens. When your knee becomes stronger, pain when on rest or pain when walking will reduce. So the solution is knee exercises, and you're going to get a video on that. Evelyn Sardinha. Doctor, I have been taking CARTIMOVE, which is 75 mg glucosamine, which was prescribed by my doctor, and every week nanoferol, vitamin D3 and bunocal. That is all vitamin D supplements, cholecalciferol and stuff like that. I have been taking that for over 3 years. Is it advisable to take the same for a long period, as I am suffering for osteoarthritis for many years? I am a senior citizen. Of late, when I noticed that when I go for walks, my knee pains and I get a feeling of crackling when I get up after sitting for long. Is it because of continuous medication of CARTIMOVE or all the vitamins? Please advise. Okay, you have been taking CARTIMOVE, which is a supplement which could help for osteoarthritis, but that alone will not prevent the progress of osteoarthritis. It might reduce your pain, it might slow it down, but you need to start doing exercises for your knee in order for your pain to completely reduce or even reduce, or your osteoarthritis also to progress in a slow manner. The feeling of crackling is not because of the medication. The feeling of crackling is because your osteoarthritis is progressing. Feeling of crackling when you sit and when you get up is also because you're having more wear and tear in the knee. It's time you started doing strengthening exercises for your knee, which will really help. Bina Francis asks me, Doctor, I don't have any pain but a crackling like sound when I sit and get up. Do I need to take an X-ray? I walk daily. Can you suggest any tablets for vitamin, for calcium? And my vitamin D is also really low. If you're having a cracking sound without any pain, it's your tendon snapping, so don't worry about it. Even when you have the first inkling of pain, and if your activities of daily life you're not able to do them because of the pain, then it's a good time for you to do the X-ray. Otherwise, it's not needed. Don't worry about sound, only worry about the pain. Hey guys, thank you so much for your questions, and I hope that my answers were informative, useful, and were to the point. If you need any further clarification on these answers, you know how to get me to answer your questions now. Alright guys, signing off, Dr. Santhosh Jacob, your orthopedic surgeon and COVID-19 physician from the city of Chennai, Tamil Nadu in India. Bye-bye. Thank you once again for all your questions. See ya.